We're doing very well here, Neil. And you?
Fantastic. Today's topic, headaches during pregnancy. What are some common headaches in the first trimester?
Well, the most common one, Neil, is tension headaches, and that's feels like a band around the head, and it's probably brought on by hormone level changes, stress, fatigue, eye strain. The second most common headache is a sinus headache, and that has we have four sinuses, two here and two here. So if you have pain in one of those places and swelling, runny nose, nasal congestion, that's probably a sinus headache.
Are headaches in the first trimester likely to be dangerous?
Generally speaking, not. You're not likely to have preeclampsia or any other kind of high blood pressure. Also, not very likely to have a brain tumor or an aneurysm. Those would be very rare in pregnancy.
How do you know if your headache is a sinus infection?
Well, like I just said, you've got four sinuses, one, two here and two here, and face pain, swelling, fever, and sometimes, there's a difference. Some of these are just allergy headaches, which would respond to something like steroid or a steroid shot. Some people come in twice a year for that. But bacterial sinus infections do occur, and that's when they are caused. That's when you have the face pain, swelling, and the fever.
When are headaches due to preeclampsia or high blood pressure most likely to occur?
Well, they are most likely to occur after 20 weeks of pregnancy because that's when you're most likely to get preeclampsia or eclampsia. Strokes are rare in pregnancy, but they can be associated with injury and death. The good news is that those things are avoidable or preventable.
Are migraine headaches more likely to occur during pregnancy?
Yes, unfortunately, they are. Again, this might be hormone changes. They could be brought on by triggers like fatigue, low blood pressure, dehydration, and caffeine withdrawal.
What can you do if you have a migraine during pregnancy?
Well, no, it's hard to say relax because they are painful, but that's one of the recommendations. Resting, find a dark place to rest. Try deep breathing, other relaxation techniques, cold compresses on the forehead or in the back of the neck. Can also try a warm. Be sure to remain hydrated, drink enough water, eat small, frequent meals. Tylenol is recommended sometimes, but some articles and some providers think that Tylenol isn't safe for pregnancy. So contact your doctor, see what your provider says.
Do the headaches of preeclampsia always occur before delivery?
Well, most often they do, Neil, occur before delivery, but they can occur and actually be worse after delivery, and they can occur anywhere between delivery time and 6 weeks later.
What's the difference between a tension headache and a migraine?
Well, tension headache is more common, and it feels like a band around your head. And you can manage it by over-the-counter pain medications like Tylenol. Again, talk to your doctor. Migraine headaches are more severe and often occur on one side or the other, and they're often accompanied by aura, which is a visual disturbance and sometimes actually a hearing disturbance. But visual field distortion is common. Migraines are debilitating and they are accompanied by symptoms like nausea, vomiting, light sensitivity, and sound sensitivity.
Is pain in the upper right side of your belly below your ribs and the side of a preeclampsia?
Yes, it is. It's associated with liver capsule swelling. Their liver is encased in a capsule, and that's because it's basically like a hamburger. It doesn't have much of its own shape, but you don't want to rupture the capsule. That is deadly. So, right upper quadrant pain is associated with liver capsule rupture. You should seek medical attention immediately if you think you have right upper quadrant pain.
What if Tylenol doesn't get rid of your headaches when you're pregnant?
Well, any headache that lasts more than 2 hours and is new, you should call your doctor if Tylenol doesn't work.
How long is too long to have a headache during pregnancy?
24 hours for headaches that are new or surprising.
Will the ER do anything about my headache?
Generally speaking, no. ER doctors are not headache specialists. Their main goal is to make sure that there's nothing serious or life-threatening. They call it treat 'em and street 'em.
When should you be concerned about your headache during pregnancy?
Well, if it's severe, the worst headache of your life, if it's throbbing, it doesn't go away, blurred vision, changes in vision, swelling of your hands or face, find a doctor right away.
All right, best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.